Over the past 25 years, I have witnessed the evolution of breast augmentation surgery as a board-certified plastic surgeon in Beverly Hills. The most amazing thing about breast implants over the past 30 to 40 years is that they do a beautiful job very accurately, and that's why breast implants have stayed viable for all of these years. Since 25 years ago, when I started my private practice, breast implants have become much safer. The implant is not filled with a liquid gel as it used to be. So if there is any damage to the shell surrounding the implant, these implants don't leak. In fact, if you grab one of these implants and cut it in half and squeeze it, the gel will come out, but when you relax, the gel will go back in. Over the past 5 years, I would say that I'm very happy to hear that patients are going for smaller implants, because you can look amazing even with very small implants that accomplish what you exactly want. You can also be athletically more inclined if you have smaller implants. You can have more physical activity and freedom to be yourself regardless of the environment that you're in. I have patients who come back from many years ago, from 20 years ago or 15 years ago, and they have perioral incisions which are almost completely invisible. But something happened as we were trying to discover how to prevent capsule formation and prevent the potentiality of a biofilm formation around the implants, and we moved away because of these studies that came out from the perioral incision and towards the inframammary fold incision. So I had to make that move as well, and around 2007, 2006, we moved towards the inframammary fold incision, figured out how to do them so that they're totally invisible by placing them exactly where the inframammary fold is or will be, making them super short, probably maybe even a 2.5 centimeter incision will allow us to place a much larger implant. Using the no-touch technique, which is essential in preventing biofilm, and basically no-touch technique is what it actually says. We try not to touch the implant except for the surgeon for the moment that he transfers the implant from the box container to the funnel, and after that the placement is completely done without touching using the Keller funnel. Breast implants are much safer, the results are much more predictable, and we can get really amazing results very safely. We also have this whole new technology, what we call fat grafting, and I love fat grafting in conjunction with breast augmentation, whether to create more cleavage or more upper fullness, or whether we're just completely moving away from breast implants and into just fat augmentation or breast augmentation with autologous fat grafts, and that works amazingly well. And of course, the other variable is that they have to have enough fat to donate from other locations in their body. Generally, the results with fat augmentation of the breast is more conservative. It looks relatively more natural because of the placement of the fat as opposed to the implant, which can very easily give us excessive fullness that the fat grafts cannot provide. So we have a lot of options. Breast implant surgery has come a long way. In one sentence, is it safe or is it unsafe? I feel that it's safer than it has ever been, and we can get really amazing results for the patients. I don't think if you're interested in getting implants, you should shy away from them. Oftentimes they have to be done along with other procedures such as a breast lift or potential correction of deformity or asymmetry in the breast, and implants are a very viable tool for us as plastic surgeons. The consultation is very comfortable in a setting where the patient comes in, I get a history, answer their questions. Please come in with your questions ready to ask them. They make the procedure safer, they make the results much more reliable,